Could we imagine a world where the word cancer is nothing more than a constellation in the night sky? A world where the human genome is free from the grip of this dread disease? It's a provocative thought indeed. Yet to ponder such a possibility, we first need to understand what we're up against. Cancer, in its most basic form, is a group of diseases characterized by the uncontrolled growth and division of cells. It's a genetic rebel, a mutinous mutation that takes hold in the body's tissues and organs. There's no one type of cancer. It's a complex, heterogeneous disease with a myriad of subtypes and mechanisms of development. This complexity makes it an elusive enemy, difficult to corner and even harder to defeat. Over the years, we've made impressive strides in the battle against cancer. Early detection, for instance, has become a frontline defense. Screening tests like mammograms, colonoscopies, and pap smears allow us to spot the enemy while it's still small enough to take down, improving treatment outcomes. Then there's precision medicine, a bespoke approach to warfare. Rather than one-size-fits-all, we're tailoring our strategies, shaping our weapons to fit the unique genetic makeup and biology of the patient and their tumor. It's a promising field that aims to deliver the most effective treatments for specific types of cancer and patients. Immunotherapy, meanwhile, is turning our bodies into battlegrounds, rallying our immune systems to recognize and attack cancer cells. From checkpoint inhibitors to CAR T-cell therapy and cancer vaccines, these therapies are showing promise in certain patient populations. The promise of gene editing, too, looms on the horizon. Techniques like CRISPR-Cas9 could potentially correct the genetic mutations that cause cancer or prime our immune cells to target and eliminate cancer cells more effectively. But this is still a field in its infancy, requiring more research and development before it can be widely applied. And let's not forget the power of lifestyle factors. Simple choices like maintaining a balanced diet, exercising regularly, avoiding tobacco and excessive alcohol, and managing stress can reduce our risk of developing certain cancers. Despite these advancements, completely eradicating cancer from our genome remains a daunting task. It demands ongoing research, collaboration, and education. It requires us to understand the very essence of cancer biology and to develop even more effective strategies for prevention, diagnosis, and treatment. So can we imagine a world free from the grasp of cancer? It's a tantalizing thought. And while we may not be there yet, every step we take brings us closer to that goal. The battle continues, and as we arm ourselves with knowledge and innovation, we remain hopeful for a future where cancer is nothing more than a constellation in the night sky.